chest pain. It's a sensation that can strike fear into anyone's heart. It's a terrifying experience, often sending shivers down our spines and conjuring images of heart attacks. The immediate thought is always the worst-case scenario. But what if the culprit isn't the heart at all? What if the pain is coming from somewhere else entirely? What if it's a silent mimic, a condition lurking in the shadows, often misdiagnosed and misunderstood? This hidden ailment can be just as alarming. This is the story of costochondritis, a condition that causes chest pain so severe it can feel like a heart attack. The pain can be sharp, stabbing, and incredibly intense. This essay delves into the world of this often overlooked condition, exploring its causes, symptoms, and the impact it has on the lives of those it affects. We'll look at how it is diagnosed and the various treatment options available. We'll hear personal stories, uncover shocking statistics, and empower you with the knowledge to recognize and manage costochondritis. By understanding this condition better, we can reduce the fear and anxiety it causes and improve the quality of life for those who suffer from it. Costochondritis. The name itself sounds complicated, but the reality is surprisingly simple. This condition involves inflammation of the costochondral joints, the areas where your ribs connect to your breastbone. Imagine these joints, usually smooth and flexible, becoming irritated and swollen. The result? Pain, often sharp and stabbing, centered right in the middle of your chest. It's no wonder that costochondritis is frequently mistaken for a heart attack. The pain can be so intense that it sends people rushing to the emergency room, only to be told their hearts are perfectly fine. Erin, a young professional living in the bustling city of New York, knows this experience all too well. One minute she was rushing to catch the subway, the next she was doubled over in excruciating chest pain. "I thought I was having a heart attack," she recalls, her voice shaking slightly as she recounts the terrifying experience. "I was only 32, but the pain was so real, so intense. I really thought this was it." Erin's story is not unique. Countless individuals, particularly women, find themselves caught in the grip of costochondritis, their lives turned upside down by a condition that often goes undiagnosed and untreated. The true prevalence of costochondritis remains shrouded in mystery, often lurking in the shadows of misdiagnosis. Some studies suggest that it may be responsible for as much as 30% of chest pain cases in emergency rooms. In his book, The Complete Guide to Chest Pain, Dr. Peter Askes sheds light on this often overlooked condition, revealing that a significant portion of individuals experiencing chest pain may actually be suffering from costochondritis. Despite these alarming statistics, costochondritis remains a poorly understood and frequently misdiagnosed condition. This lack of awareness can have serious consequences, leading to unnecessary anxiety, inappropriate treatments, and a delay in receiving the right care. Unmasking the mimic, diagnosing costochondritis. Diagnosing costochondritis can be a real challenge. This condition, which causes inflammation of the cartilage that connects a rib to the breastbone, often mimics other serious conditions, making it tricky to identify. There's no single test, no magic bullet that can definitively pinpoint the condition. Instead, it requires a combination of clinical evaluation and diagnostic tests. Doctors often rely on a process of elimination, carefully ruling out other potential causes of chest pain, such as heart problems, lung issues, or gastrointestinal disorders. This methodical approach ensures that other serious conditions are not overlooked. This typically involves a physical exam, during which the doctor will gently press on the chest wall to check for areas of tenderness. The presence of pain when pressure is applied to the chest wall is a key indicator of costochondritis. They may also order imaging tests, such as an X-ray or EKG, to rule out other conditions. These tests help ensure that the chest pain is not due to a more serious underlying issue, such as a heart attack or lung disease. It's a process that requires patience, both from the patient and the healthcare provider, but one that's crucial for ensuring the correct diagnosis and treatment plan. Understanding the nature of costochondritis and its symptoms is essential for effective management and relief from discomfort. With a thorough and careful approach, doctors can help patients find the right path to recovery. Causes and triggers, from strenuous exercise to heavy lifting. The exact causes of costochondritis remain somewhat elusive, adding to the complexity of this perplexing condition. Despite extensive research, the medical community has yet to pinpoint a single definitive cause. This uncertainty often leads to frustration for those affected, as they seek answers and effective treatments. However, several factors have been identified as potential triggers, shedding light on what might be going on beneath the surface. These triggers can vary widely from person to person, making it essential to consider individual circumstances when diagnosing and treating costochondritis. Strenuous exercise, particularly activities that involve repetitive movements of the chest wall, can irritate the costochondral joints, leading to inflammation and pain. This is especially true for athletes and fitness enthusiasts who frequently engage in high-intensity workouts. Over time, the repeated stress on the chest area can cause significant discomfort. Heavy lifting, especially if done improperly, can also put excessive strain on these joints, increasing the risk of developing costochondritis. Proper lifting techniques and adequate rest periods are crucial in preventing this condition. It's important to listen to your body and avoid pushing beyond your limits. Even minor trauma to the chest, such as a blow to the ribs or a fall, can trigger the onset of this painful condition. Accidents and injuries, no matter how small, should not be overlooked, as they can have lasting effects on the chest area. Seeking prompt medical attention can help mitigate the impact and prevent further complications. Sarah's experience: a heavy cat and a painful reality. Sarah, a middle-aged woman living in a quiet suburb, discovered the unexpected trigger for her costochondritis in a rather unusual way. "I was carrying my cat, who's rather large I might add, when I felt this sharp pain in my chest," she explains, her voice tinged with a mix of amusement and frustration. "I never would have guessed that something as simple as carrying my cat could lead to such excruciating pain." Sarah's experience highlights the unpredictable nature of costochondritis, a condition that can strike seemingly out of nowhere, triggered by activities we often take for granted. Prevention is key expert tips from Kathy Narkisi. While the exact causes of costochondritis may remain somewhat of a mystery, there are steps individuals can take to reduce their risk of developing this painful condition. Kathy Narkisi, a renowned physical therapist specializing in musculoskeletal disorders, emphasizes the importance of proper posture and body mechanics. Maintaining good posture both while sitting and standing can help reduce strain on the chest wall, she explains. Similarly, practicing proper lifting techniques such as bending at the knees and keeping the object close to the body can help prevent injury to the costochondral joints. Living with costochondritis. Treatment and pain management. Living with costochondritis can be challenging, but it's not a life sentence of pain and discomfort. With the right treatment and management strategies, individuals can find relief from their symptoms and live full and active lives. Treatment typically focuses on reducing inflammation and pain, often starting with conservative measures such as rest, heat, or ice therapy, and over-the-counter pain relievers. In some cases, doctors may recommend prescription medications, such as nonsteroidal anti-inflammatory drugs or even corticosteroid injections, to help manage the inflammation and pain. Breaking the silence. Raising awareness for costochondritis. Raising awareness about costochondritis is crucial. By shedding light on this often misunderstood condition, we can empower individuals to recognize the symptoms, seek timely medical attention, and receive the appropriate care they need. It's time to break the silence surrounding costochondritis and ensure that it no longer lurks in the shadows of misdiagnosis and neglect. Finding support and hope. Resources for patients. For those living with costochondritis, it's essential to remember that you're not alone. Numerous resources are available to provide support, guidance, and a sense of community. Online forums and support groups offer a platform for individuals to connect with others who understand their experiences, share coping strategies, and offer words of encouragement. Additionally, reputable healthcare organizations and websites provide valuable information about costochondritis, including its causes, symptoms, treatment options, and tips for managing the condition. Remember, knowledge is power, and by arming yourself with information and seeking support, you can navigate the challenges of costochondritis and live a full and fulfilling